Now here at 5, we have an update on the condition of the 10-year-old Detroit girl who was mauled by a dog.
Yeah, surgeons report they were able to reattach her severed arm and save her severely damaged foot. The young girl was attacked by a pit bull Saturday outside her aunt's home on the city's east side. The girl remains in critical condition. The dog is being held by Detroit Animal Control.
Fascinating. Obviously, just the medical procedure part of this raises a lot of issues about how remarkable this is for doctors to reattach an arm. Yeah. So we brought in Dr. Frank McGeorge to talk. Common isn't the right word for this procedure, but increasingly so, right?
Yeah, it's actually far more common than you might think. In fact, the fact is there are a lot of different factors we have to consider if reattachment is likely to be successful and should even be attempted. For example, the type of injury. Now, if a limb was crushed compared to cut, for example, crushing is much worse. How many structures are still functional? Bone, muscle, and nerves, they can all heal, but only if there's a good blood supply. So all of that needs to be factored in. But generally, though, if there's any chance that a limb can be salvaged, we will often try, but expectations have to be set realistically. Regaining even 50% of function is generally considered to be a very good outcome. So it can be attached, but with limitations.
Yeah, but as far as being a child, how does that impact it? You would think that a child's little muscles and bones are, you know, smaller and maybe not able to...
Right, might be more delicate, for example.
Yeah.
So yeah, that might be one way to look at it. But, you know, of course, when these things happen to a child, it's really that much more upsetting. But in fact, children generally have a much better chance of a successful outcome. First of all, because they're usually healthy. They don't have any vascular disease, so their blood supply is good. Also, while this kind of damage to a limb would be distressing to anyone, children can actually get used to the new normal much better than adults when they lose partial function. But the most important thing, of course, is that children simply heal much better. So wherever possible, reconnection in children is actually preferred, but of course the risk for infection or other post-surgical complications are really the same, and that's the main thing that they have to watch for at this point, are complications.
And of course children are still growing, so that development probably helps move it along too, right?
That's exactly it. There's lots of new growth that happens there. And in fact, when they reattach limbs, there is continued growth. And even in young children, the limb will grow out often to 80% or so of the previously expected growth.
Never thought about it that way. Yeah, that is phenomenal. Okay, thanks, Doc.